My name is Lorna Busch. I'm a licensed clinical psychologist, and I'm located in the Finger Lakes area, about an hour from Rochester, New York. I have a private practice here, and I also run retreats. So with my private practice, obviously I do ketamine-assisted psychotherapy, and that's embedded within a wellness center. So I've partnered with other practitioners that do body work, yoga, meditation, energy work, and sound healing. I find that the holistic approach really fits in with what I'm going for as far as healing based on my own personal journey and working with clients. So that is a little bit about me and my practice. I had some colleagues and mentors that were working with psychedelic medicine. And so I got exposed to it through them. And then I joined a research group at a local hospital. And the more that I learned about this type of treatment, the more it became evident that this is really promising in helping people really get to the root cause of their distress and their suffering, as opposed to relief of symptoms. So it tended to lend itself well to enduring change. And to me, that feels more curative rather than treating some kind of diagnosis. So here in the regional area that I am, around the Rochester, New York area, when I started doing this, I couldn't find anyone else in my area that was doing ketamine-assisted psychotherapy. So it was very kind of isolating. I had to reach a lot further out to have other people to collaborate with. So that was one reason. I have quite a collaboration of other practitioners that I work with. And another is that as far as a prescriber, it's hard to find a prescriber that has the training to prescribe ketamine that is really familiar with this. And so in my region where I'm located, there was no one that could do that for me. I had searched around amongst many doctors and nurse practitioners in psychiatry. So this gave me access to someone who was very skilled in prescribing that could work with my clients, and not only skilled, but very compassionate with my clients. So I really like their practitioners that they work with, both in their skill and knowledge, and both in how they treat patients and their colleagues. Both in my private practice and retreats. So in the retreats, I'll start there. I've had clients come back and do a second retreat. So far, each person that's come to the retreat has reported having quite a profound experience. And so they contact me and we stay in touch. And often months later, they're still telling me how this is being integrated into their lives and what an effect this is having on their lives. And then through my private practice, I do have a lot of people coming to me that have tried other treatments and therapies for their chronic depression, anxiety, or PTSD, and having minimal effect with prior treatments. And so sometimes they come to me and this is their last hope. So for a majority of those people, this has been something that's been really helpful for them. So they report feeling much better and experiencing their life in a much different way that is much more enduring than simple symptom relief. So I've worked in my background as far as my career. I've worked in hospitals and clinics before, and it's very much embedded in that medical model. And CAP is as well, but having my own private practice allows me to really tend to things like the set and the setting that are so important for the experience. So in my own personal journey and training, I had to do experiential training as a ketamine-assisted psychotherapist. The most profound experience I had was in an outdoor setting. And so there's something about the natural environment where people can reconnect to what they're often disconnected from, which is themselves, others, the natural world. So I'm able to create the space and the setting for the person that is very natural. It's not very clinical, and people tend to heal well in those environments. And currently I'm working on having some outdoor space out here in the Finger Lakes where people can have their dosing session in an outdoor area, at least access to the outdoors. Part of the healing that happens with psychedelic-assisted psychotherapy is lends itself to the inner healer coming through. So it's allowing the person to access their inner wisdom. And so there's a lot that we can do as therapists just to be there and walk alongside the person. So it's not like we're coming in to fix anybody. So recognizing that and just having a really calm and genuine presence with the other and setting up that kind of set and setting for the person is really important. So I would encourage them to recognize that, and also recognize that if they join Journey Clinical, there's quite a support system for them, both in training and getting them the knowledge and skill that they need, but also in other practitioners who are here to support them and help them really develop their practice into what feels right for them. And that's something that's been wonderful with Journey Clinical, in that there's such a support for that, both in other therapists, administrative support, and in the medical team as well. Well, one thing, I hope that this becomes a lot more accessible to people. So personally, I know for my private practice, there's quite a long wait list. And so with the access that Journey Clinical is providing for therapists like myself to be able to serve a lot more people and support things like group ketamine sessions, I feel it's very hopeful that more people will have access to this type of treatment.